I can recall that one long stay in the hospital, we almost didn't make it home for Christmas to be with our older son. And so that was a really stressful time, really hard time for our family. Multiple medications had failed. And one day in the hospital, I think they put him on a lot of Ativan. And so he was just laying in the hospital bed, just unconscious. And I asked the doctor, what are our options here? What can be done? Because we've tried multiple medications. I think at the time we were on 4 medications. And I said, where do you think we go from here? And at the time, I didn't really know much about diet therapy. And I had just heard whispers about it, that it might be a viable option. And so I just asked the neurologist and what he thought, since, we're in the hospital, he's having cluster seizures, one inside of every hour. And he said, well, we'll take a look at other medications. And that just didn't sit well with me. And I said, well, what about I heard about diet therapy. What do you think about diet therapy? I don't really know much about it. And he said, oh, no. He would have to be having more than 100 seizures a day for us to explore diet therapy. And in that moment, my gut said to me, this was not right. I don't know what the right answer is in this moment. I don't have the education, but I know that answer was not right for Nathan. I just looked at my son in the bed, just unconscious, and I thought, what is the difference of the quality of his life if he's just laying here in the bed? He would be laying here in the bed if he was having 100 seizures a day. So at this point where we are, why can't we explore other options? It was very challenging because we just seemed to be chasing the dose every time there was a breakthrough seizure. And he would have constipation and skin issues and irritability. And it was just horrific. It truly, truly was just absolutely horrific. I didn't feel like I got answers when I went to see the doctors. I just felt like they were chasing the dose. Everything felt like they were just throwing spaghetti at the wall and just trying to see what stuck, but they didn't really understand why he was having seizures or making sure that the type of seizure he was having was being medicated by the right medication that showed efficacy for that specific seizure type. Our neurologists, they're so busy. And I remember numerous times calling the office because not everything is, emergency that needs to go to the hospital and things like that. And so I remember on many occasions calling the office, seeking support, trying to send in videos of the new seizures types that I was seeing from my son, and not getting a call back for days, and just calling and expressing my frustration with the staff, only to be told, well, the doctor's very busy. So basically, I'm just a number in line. And that didn't sit well with me at all. Initially, it took a little bit of time for me to explain to friends and family that he was on a diet therapy for seizures and how it worked. A lot of people thought that I was just being very strict. A lot of people would roll their eyes about gluten. They would say things like, well, gluten's been around for a long time. Well, what they're spraying gluten with, it has not been around for a long time. So let's talk about the facts. And so I think that it took the major transformation in seeing where Nathan was to having lots of seizures and really being out of it having head drops or just sleeping all the time with an unconvulsive status epilepticus. It really took time for people to see the transformation that knew I was doing diet therapy. We didn't travel for a long time because my fear was if he did have a seizure and it escalated into something very serious, it would really just ruin the whole entire trip. So that is challenging initially, and it's for everyone to figure out what's going to be best for them. For us, I do prepare separate food for Nathan. So he has his food. I meal prep for him. It took a little a little effort to learn and understand what I wanted to do. Sometimes it can be a little bit more time consuming, since if I were to make 2 meals or to make an extra side for him, it was challenging to figure out and view everyone's perspective in this situation. And initially, because witnessing my youngest son's seizures, I felt could be traumatic for my oldest, I would ask my oldest to go to his room or go play or do something so that I could take care of Nathan. Or my husband would distract my oldest and remove him from the area so that I can take care of Nathan. But we made a point, my husband and I, we really made an effort to make sure that whenever Nathan had a seizure, that we always remained calm so that my oldest would not feel the anxiety or so that we could try to protect him from the trauma that this might make him feel or carry with him through his life. And so we just wanted to make sure that we remained calm and assured him that we're going to do our best to take care of Nathan and stop the seizures and do everything we can. And also we would have conversations with him and let him know that in life, sometimes things happen and we don't understand why they happen, but we have to do our very best to treat the situation the best that we can and overcome it and continue with life. And then as he got a little bit older, because he's only 4 years older than Nathan. And so as he got a little bit older and he started asking me questions, I remember one day in the car, he asked me, he said, "Mom, is Nathan special?" And I kind of got choked up at the question, and I thought, well, how observant is he? And I said, "Yes, buddy, he is." I said, what brings on that question? And he said, well, in my class this year, the teacher says that another little boy in his class is also special. He said, and I noticed that, he needs help doing some things, and I try to help him. And I just thought, he's growing up so much and he's learning, but I can hear the compassion in his voice and the curiosity. And so I decided to talk to him more about it. I figured that he was ready to talk more about Nathan and epilepsy. Every single day where it's like, oh, thank goodness he's doing well. He's healthy. I have not had to go to the hospital and battle with these seizures, because that's really what it felt like. And I was full of anxiety. I look to other mothers that are feeling the same way that I did, full of anxiety, brokenhearted, watching their child suffer through seizures. And I remember feeling that exact way. There's not a lot of guidance out there sometimes. You meet the doctors that are not experienced in diet therapy, they may not be able to support you. But then the opposite is true. Sometimes there's wonderful doctors that you really like, you appreciate them, they seem helpful, but they lack experience. And you don't have time as a parent to teach the doctors about how to support you. You need to find the experienced neurologists and nutritionists so they can help guide you on the journey, because it is a challenging journey. It is a windy road. I've been at it for, like you said, over 10 years now, and it wasn't easy. There was challenges, there was seizure breakthroughs, and we would go long periods of time without seizure, and then when a seizure would happen, I would just break down crying and feeling like I was a failure. Like, what happened here? How could this happen? I thought I was doing good. What did I do bad? I thought.